Hey, guess what?
What's up?
Andy gave us some new palpations on the knee. Hi, my name is Laura Coleman.
And I'm Cesar.
And we are going to show you guys 10 palpations of the knee. So let's get started. So the first palpation that we're going to learn today is where the joint line of the patella is. So if you come closely, we have the patient in extension, relaxed. You're going to start proximal patella, and you're going to slowly move your thumbs inferiorly until you feel the spaces of where the tibia and the femur separate. And that's right here.
For the second palpation, we're going to look at the medial and lateral epicondyles. So with the knee flex, you're going to locate the patella and navigate laterally where you can feel a prominent bump, which is the fibular head, and right proximal to that is going to be the lateral epicondyle. And if you go down to the medial side, you'll be able to feel that prominent bump, which is the medial epicondyle.
So the next palpation that we'll be working on are the meniscal windows of the knee. If you have the patient go into extension and then you slowly have them go into flexion, you can see where it looks like a diamond. Within those indentions is where your meniscal windows are located. And if you push further, you can feel the menisci.
We're going to locate the pes anserine complex. So by locating the tibial tuberosity, which is the bony prominence right under the patella, you're going to go an inch off to the medial side, and you can explore its flat surface and also feel for some tendons that attach there. So you got the gracilis, the sartorius, and the semitendinosus that attach at this complex.
Another palpation that we're going to learn today is where the tibial tuberosity is located. So if you look closely at the knee, you have the patient extend, you can see or feel this bony-like prominence right under the patella. If you have them flex, it juts out. So it's located right under the patella, and the patellar ligament will attach right above this site.
The next palpation, we're going to look at the adductor tubercle. So by locating the medial epicondyle, we're going to go superiorly, and you're going to feel the femur flatten out where the soft tissue's at, and that's where you can feel a bony prominence that's going to be really small. That's the adductor tubercle.
Another palpation that we're going to examine today are the lateral and medial femoral condyles. So you take the patient into extension because that is when the patella is relaxed. I'll demonstrate by shifting the patella medially and laterally. So in order to find the femoral condyles, let's start with the lateral condyle first. So you're going to shift the patella medially, and right as you shift it, you feel like a knobby prominence, and that's going to be your femoral condyle. Now to find the medial femoral condyle, you're going to shift the patella laterally, and you'll find the same knobby-like prominence, and that's your medial femoral condyle.
For the next two palpations, we're going to look at the LCL and the MCL. So in order to locate these, you look at the medial epicondyle for the MCL, and you're going to slide your thumb distally inside the crevice of the joint space, and you can strum that medial collateral ligament. For the LCL, you'll find the lateral epicondyle and the fibular head, and you can actually put your finger in between those two and feel the tendon, or you can go ahead and ask the patient to rotate their leg, and looking for those structures again, you'll feel the ligament right in between.
One of the final palpations we'll be observing today are the medial and lateral tibial plateaus. So you have your patient in flexion, and you locate the patella. You want to slide inferiorly, and you'll feel the knee gets softer. Once you push in and continue more inferiorly, you can feel the head or the plateau of the tibia, and above will be of the femur. and you can follow along the edges of these plateaus.
Palpation, we're going to locate the meniscus of the knee. So for the medial meniscus, you'll just be looking for the tibial plateau. And then you're going to ask the patient to internally rotate inside the meniscal window, and you can feel the meniscus come anteriorly. And same thing for the lateral. Just go ahead and rotate laterally, and you'll feel the lateral meniscus come out.
Whew, man, that's all of them.
Yeah.
Oh, we were never gonna finish.
I know. Finally.
Wait, don't we still have to study for Jason's test? I'll go get the skeleton.